Hello.
Hi, Mr. M.
Hi.
My name is Randy.
Hi, Randy.
I'm Dr. Gonzalez's nurse. Can you tell me what brought you in today?
I came in to get my annual physical checkup.
Okay. Well, I'll be performing that for you today, and then Dr. Gonzalez will come in afterwards and see you.
Alrighty.
At this time, I would take the time to wash my hands and put gloves on. All right, Mr. M. To begin, could you tell me a little bit more about your medical history?
I get migraines.
How often would you say you get them?
Oh, 3 or 4 times a month.
And are you on any current medications?
I take sumatriptan when I get a real bad one.
Are you on any over-the-counter medications like vitamins?
I take vitamins, yeah.
Okay. All right, Mr. M. Do you have any allergies?
No, I'm not allergic to anything.
Okay. We're going to start this exam. I'm going to look at your head. We're going to look for any bumps, bruises. Do you have any history of a head injury?
No.
Okay. All right. Everything looks real good. All right, Mr. M. Next, I'm going to look at your ears. I would use an otoscope for this part of the process, but I do not have one. So I am just going to look for redness and pain. All right, sir. No redness. Do you have any pain? Okay. I'm going to perform a whisper test on this side. I'm going to cover your targus, and I'm going to whisper something and see if you can hear me.
1, 2, 3.
Okay. And we're going to come over to this one. We're going to look for redness, tenderness, and pain. Any pain?
No.
Okay, no tenderness. And your structures look good. We're going to do the whisper test on this ear as well. Okay.
A, B, C.
All right. Next, we go on to your eyes. We'd be performing a Snellen test. That's where we have a chart on the back wall that'll have letters or numbers, and you'll be looking at those. I don't have one currently up. However, he would normally stand up. He would take his glasses off, cover one eye, and he would read the smallest letter of print he could. Then he'd switch to the next eye and do the same thing. And then he'd put his glasses back on and see the smallest he could read on that as well. All right, Mr. M, you can have a seat. Thank you. All right, next I would look at your nose. Actually, going back to the eyes for 1 second, I would use a device to look, and I would make sure that they are dilating and constricting as they should. Then I would move on to your nose. Do you have a history of any nose trauma, broken noses, deviated septum?
Nope.
Okay. Have you had any drainage? And we'd look to make sure everything looks correct. Next, I'm going to have you cover one side of your nostrils and blow out the other. And then the next. Okay. Any trouble doing that?
Nope.
All right. And then I'd have you open your mouth, and I'd with a pen, a light pen, I'd be looking in, make sure everything's okay. Everything looks nice and good. Do you drink plenty of water?
Mm-hmm.
Okay. Next, I would do your vital signs. We'd watch for his breaths. We'd count how many he has for a full minute. We'd also take his temperature. For the sake of time, I'm not going to do that, however, but we would take that. I would assess his radial pulse. Can I see your arm? Thank you. I'd assess this for a full minute as well, and then I would do his blood pressures in both arms. All right, Mr. M, I'm going to start with your blood pressure in this arm. All right. All right, Mr. M, I got 110/60. Does that sound about right for you?
Yeah, that sounds about right.
Do you have any history of high blood pressure?
No, I do not.
What about your family?
It runs in my family on both sides.
Okay, you want to make sure you monitor that because sometimes it can be something that other people carry along in their family.
Okay, thank you.
You're welcome. And I'm going to assess your blood pressure in this arm as well. right, Mr. M. I got 106/64 in this arm. Okay. All right. Next, we'll be listening to your lungs. What I'm going to have you do is I'm going to put this on the back of your back, and I'm going to have you take a deep breath and let it out. All right, sir. If you'll take a deep breath and let it out. Okay. Same thing. Okay. Same thing. Okay. Same thing. Okay. We're going to listen from the front. While doing this, I would normally have my stethoscope under their clothes or their gown. For this exam, though, I'll be having it over it. Okay, go ahead. Okay, and again. Good job. Have you had any shortness of breath?
Nope.
No difficulty walking upstairs, anything like that?
Nope.
Good deal. All right, I'm going to listen to your heart. Okay. Sounds real nice and strong. All right, sir. Next thing I'm going to have you do, I'm going to have you lie down, and I'm going to listen to your abdomen. While performing this, sometimes you'll need to stay in the same place for a couple of minutes to hear the active bowel sounds. Okay, if you'll move your arms. Thank you. Okay, you can go ahead and sit back up, Mr. M. When's the last time you had a bowel movement?
Today.
Okay. Have you noticed any loss of appetite, decreased in weight in the last month? No nausea, vomiting, diarrhea, constipation?
No.
Okay. And do you eat a nutritious meal 3 times a day?
Yeah.
Good deal. All right, sir. And then we would be moving on to male genitalia. However, we won't be doing that for this video. We can still ask questions, though. Do you have any trouble urinating? Do you have to get up several times? You notice you have to go frequently?
Nope.
Okay. Do you perform testicular exams?
Mm-hmm.
All right. And also, do you perform breast exams?
No, I don't.
That's something you want to consider because males can actually get breast cancer as well.
Okay, thank you.
And we can get you some more information on that as well if you'd like.
Awesome, thanks.
No problem. All right. Moving along, I'm going to assess the rest of his pulses. We're going to assess his popliteal pulses. Okay, these are nice and strong. Assess his pedal pulses. Okay. His radial pulses are still real good. Brachial is. And then his carotid. His carotid are equal and strong as well. We'd also want to perform a skin assessment. Just looking at the bits of skin he has available to us. He's got some birthmarks. He's got tattoos. He has a scar to his lower right leg. Do you know what happened there, Mr. M?
No, I don't.
Okay. Next, I want to assess for edema. We want to assess them everywhere because some people have it in their upper arms as well. Okay. Your arms look well. Okay. No edema here. Alright, that's very good. We're also looking at hair distribution as well. All of that looks well. Mr. M, while you're sitting, if you'd bring up your heel to your shin, like so. Alright, and you're going to do the same thing with the other one. Alright, good job. We could also perform range of motion at this time. I'm going to have you extend your arm out, and then bring it in, and then out. Same thing with the other one. Okay, good job. We could have him rotate his feet. I want you to go like this. Okay, good job. And if you'll stand up, we could have him take his leg, bring it out, bring it in, and then same thing. Okay, good job. All right, Mr. M, we're also going to assess your gait. I'm going to have you walk towards me. Okay, and then go back. Okay. We're also going to assess you. You can come this direction on your tippy toes. Go straight out. Okay, and then go back. Alright, good job. Alright, Mr. M. Other things we can do, we can give you pamphlets on range of motion to make sure you stay active. Are you physically active?
Mm-hmm.
Okay. And then also, I want to assess your curvature of your spine. Have you had any trouble with that?
It hurts from time to time.
Time to time. Are you experiencing any pain right now?
No.
Okay. Well, do you have any questions or concerns for me?
Nope, nothing that I can think of.
Okay. Dr. Gonzalez will be in shortly. If there's anything I can do for you before then, just let me know. And thank you very much.